we're gonna start with a nasal release technique. A nasal release technique is beneficial for people who have experienced trauma to their head, people with concussions, people who continue to have migraines, and any orofacial pain, including TMJ disorders, and even at times involvement of the nerve, like the trigeminal nerve. And also people who deal with allergies, this is a very good technique to help open the nasal cavity. And the main idea behind the nasal release technique is to readjust structures around the face so that people can breathe better. So what we'll do, we are gonna insert this balloon into the 3 different cavities of each nostril, and we're gonna pump the balloon. That is gonna expand the structures within. So some people might say they hear crackling, popping, or a little bit of pain. And that is because the structures are shifting. So the first one we're gonna do, we're gonna go in to the left nostril. Go ahead and breathe in for me and hold. And I'm gonna do 1 pump and release. And we'll go into the next turbinate. That's what the structures are called. Breathe in and hold. 1 pump and release. Second turbinate. That one's a little bit restricted. Breathe in, hold. And then the third one, go ahead and breathe in and hold. Yeah, so you can see it's restricted again. So third one is gonna affect the sphenoid bone. Second is gonna affect more of the zygomatic or the cheekbone. And the first one, as we went in, is gonna affect more of the mandible. So again, this is for the sphenoid. Breathe in, hold. And then we get to repeat the first one again. In, hold. Okay. Good. Okay, and that's it.
All right. What did you think, Aaron? How did it feel?
Good. Definitely lots of pressure on this side. And I actually felt some pops and cracks. So. But okay. I love having it done because it helps so much with my migraines.
Awesome. Thank you.